This is NTV.
Thank you, our viewers, for joining us this late evening. I'm Karagaba, Baldwins, and we're coming to you live from the Kampala International Conference Center. As usual, we bring you informative and educative discussions at this particular hour of Saturday. Today, we're going to talk about something pretty familiar but quite intricate, and that is animal disease and the issue called zoonotic diseases, which are emerging from animals and, of course, vice versa. So before we go into a detailed discussion in the studio, let's have this introduction, then we proceed.
The global food system is experiencing profound changes as a result of anthropogenic pressures. The ever-increasing human population, which will be more than 9 billion by 2050, together with changes in consumption patterns caused by urbanization, increasing incomes, and nutritional and environmental concerns, is shaping what we eat, who eats, and how much more than ever. With this conflict of human existence and the pressure to acquire food as to sustain these populations, animals have become pivotal determinants of the sustainability and biosafety health assurance of human life. More increasingly, we are industrializing animal food output. Human populations are encroaching on animal habitats for both food and settlement, then consequentially, human beings are acquiring animal-bred diseases and infections. In the recent past, Uganda had frequent disease outbreaks between August 2017 and August 2018. Of the 8 disease outbreaks which occurred, 3 were viral hemorrhagic fevers, that is Crimean Congo hemorrhagic fever, Marburg virus disease, and Rift Valley fever. The set are among the prioritized zoonotic diseases in the country, zoonotic diseases being infectious diseases caused by bacteria, viruses and parasites that spread between animals, usually vertebrates, and humans. Recent research about veterinary drug residues in meat and meat products, titled Occurrence, Detection and Implications, done by Andrew Bamidele Falowo and Olu Wakamisi Festus Akimoladun, also spell out another major problem in our veterinary industry. The study reveals that the use of veterinary drugs in large amounts and consistently could result in deposition of antimicrobial residues in muscle and organs of animals, whereby the consumption of these residues in animal products may pose health risk to consumers, including development of antibiotic resistance bacteria, allergy, reproductive disorder, and hypersensitivity reaction. Considering this frightening development, NTV, in conjunction with the National Drugs Authority and the Uganda Veterinary Association, bring to you this live discussion as we enlighten the public on how to be safe against these stated dangers. You're welcome.
Karagaba Baldwins, again, is my name, and on the social media platforms of our station, we put a question just asking you about your impression for the government or us as a public being ready for such disease outbreaks, especially that are emanating from animals, how they can influence our population, but how we can also contain them. And I can see Aloysius Newman says that veterinary officers should work hard, and we the people have to be careful. And Julie Docas says, okay, that's a bit complicated. Arthur Nyakabwa says that Uganda's borders are still very porous, and that should be the first step. You can't have everyone come into the country with no regulation. Sounds like Trump. All right, so let me get into the studio discussion here with the prolific, great professional and public proficient experts in this particular field, and right at the very extreme end, having Dr. Anna Rose Ademun, OKurut, Commissioner Animal Health, Minister of Agriculture and Animal Industry and Fisheries. Very welcome.
Good evening, viewers.
All right, and I hope the name was pronounced true.
Yes, it was.
Okay, and in the middle still, just Dr. Sylvia Baluka, Agubua, President Uganda Veterinary Association and a board member to NDA, and I think Dr. Anna
Yes,
you're
I'm
also
a board member.
all right. You're
Thank
welcome.
you, and good evening, viewers.
Indeed. Dr. Okay, sorry about that. Dr. Muhindo Jeanne Bukeka, the Head Veterinary Products, National Drugs Authority. Dr. Jeanne, you're welcome.
Thank you. Good evening, our viewers.
Yes. Now, this is a very technical, sensitive, but vital discussion. And Dr. Anna Rose, let me start with you. Of course, in the introduction, you had us try to grapple with a bit of giving a summary to the viewer to understand what this whole phenomenon is, and we listed a number of diseases that have broken out. So we want to understand, you representing the Ministry of Agriculture, how the government is currently dealing with this ever-increasing threat of animal diseases.
Good evening, viewers, once again. Myself, I'm a commissioner for animal health. The ministry is working together with the Ministry of Health and, of course, the National Drug Authority to see to it that these diseases do not spill, especially from the animal populations to the human populations. So the most important thing that we do is to advise the population how they are supposed to interact with the food animals and also the wild animals that have most of these diseases. So the biggest and most important way is actually to create awareness. And that's why we are here today, to create awareness of the population that you should know how you interact with the animals. You should know how to interact with the food, what you're likely to get from that food, what you're likely to get when you interact with a monkey. The monkey might have Ebola, or when you interact with a goat might have Rift Valley fever. So how do you handle it? So that is the most important thing. Otherwise, we have to interact with these animals because they are also our food. And therefore, we must eat the food, but we must know where do we get this food from, how do we get it, how do you use it, how do you handle it, how do you cook it, and how do you make it good for you and for your health. Yeah.
Oh, very simple and elaborate, but clear introduction in this particular matter. All right, so let me get to Dr. Sylvia. You have the Uganda Veterinary Board. This is now the governance structure of this particular area, which is the professional regulatory body established by the Veterinary Surgeons Act, which is...
This is Veterinary Session.
Pardon?
I'm from the Veterinary Session, President.
Yes, absolutely. But the Veterinary Board, Uganda Veterinary Board, is the top governing organ that was set up by the Veterinary Surgeons Act 1958, and it helps to stipulate the profession and ensuring that there is high repute in the country, appointed, and it's usually the body is appointed by the minister and all this particular detail. And so you're representing the Veterinary Association of Uganda. What is the role of that particular association and, of course, the professional practitioners in that particular field?
Thank you so much. The Uganda Veterinary Association is the professional umbrella body that brings together all veterinarians in Uganda. As a professional body, it's a platform where we remind ourselves of our professional code of practice. We have ethical standards that we are expected to follow, as provided and guided by the Uganda Veterinary Board. So what the Veterinary Association does is to mobilize, keep members together. Uganda Veterinary Association is a spokesperson for all veterinarians in Uganda concerning our welfare, concerning all issues where we have an interest, where we have a stake. And we use this platform to encourage professionalism, to remind ourselves that we are a noble profession, and we were admitted into this profession upon an oath that we all take on the day before we graduate, before we are awarded the Bachelor of Veterinary Medicine by our university, Makerere University, which is the only university that awards veterinary degrees in this country. So we remind ourselves to stay professional and serve our farmers, to attend to all the animals. However, as a profession, we face a number of constraints. In this country, we don't have a single veterinary hospital. We don't have even a veterinary clinic per se, which can really provide referral services. So most veterinary services in this country are at the farm. And it is the veterinarian who moves to where the sick animal is upon receiving a call from the farmer. So this sort of, this approach that we are using faces a number of constraints. And the veterinarians currently, our facilitation in terms of movement, transport is quite limited. It means most of the time my members are relying on border. And I always say veterinary services are as reliable as the border until when our ministry is able to facilitate our members to move timely. You know, with all the diseases, animal diseases just like human diseases, timely diagnosis is very important. Timely reporting is important. Timely diagnosis is important. Timely response is important. If we are actually to intervene and be able to treat in case treatment is required, or carry out a surgery in case it is required, everything must be timely. And right now we fall short of delivering timely services to the people that need our services.
Yes, so did I hear you insinuate that you would wish to have a hospital where people take animals, they're treated like human patients?
At least,
don't you think that is quite impractical and cumbersome? Because animals, it's known that spread across the land, everyone is a farmer. They are concentrated areas where farming is more prominent. So I think it sounds quite impractical for you to demand that.
I think it's practical. Uganda is a model country. We are developing quite fast. We have so many plans, and we are talking about a middle income country. There are certain things, certain basics, at least as a country, I think we deserve to have at least a single functional animal hospital.
Okay.
What's the name? Where people can go for, our expatriates can find services similar to what they have in their countries, where our students can go for internship. I think we're not asking for too much if we talk about animal hospital.
Okay, we'll keep on exploring that a little bit more. Thank you over that. Dr. Muhindo, now you are representing the National Drugs Authority, and just for purposes of clarity on what this is, it's an established agency that was set up by the National Drug Policy and Authority Statute. I hope you're in agreement with that.
Yes.
And in 2000 became the National Drug Policy and Authority Act, and so the act is established as a drug policy to ensure that there is availability at all times of essential drugs and everything that is in line with the drug aspect in the nation. So just help us to now be more customized to the veterinary industry. What is the regulatory framework in regard to the veterinary area in terms of importation, handling, distribution, and use?
Okay, thank you very much. National Drug Authority, as you've said, was set up in 1993 to oversee both the human and animal medicines, to make sure that they are safe, effective, and are of good quality, and to serve the entire population of this nation. So National Drug Authority, actually, we've just been in the mood of celebrating our 25 years of existence with key milestones, among which is the veterinary sector, whereby I think NDA has contributed to the increased animal population, which now, especially for cattle, which stands at 14 million.
Oh, you attribute that to NDA?
Yes, because like they have told you, these animals fall sick, and if they fall sick, definitely the veterinary drugs are part of the inputs that are needed. And how do we do this? Because the mandate that was given to us, we control importation of all drugs that come into this country. And like you've read, we control from production. We have what we call a professional stakeholders. We have pharmacists, we have vets, we have chemists, we have all the sciences that you can think of in this country. A National Drug Authority employs as such. So what we do, we assess the information for people who are interested in marketing their products in this country. We assess the information through the dossiers. They submit documents called dossiers, which tells us about the product quality, the safety and efficacy of this particular product. And what we are interested in most when it comes to vet drugs is that when the human beings take these products from the animals, then they have to be safe, because the residues must not be in these animals' products. And that's why now we encourage the extension workers and the farmers to observe what we call the drug withdrawal period. And also we evaluate what we call the toxicological data. For example, there are products which have been, like, for example, banned from the international trade. So we don't allow in such kind of products. Then all the products on the Ugandan market will again go outside the country, because actually in Uganda we only have 3 manufacturing facilities so far that are manufacturing our drugs, including one for the vaccine, which is thermostable. But majority of our products are imported into the country. So our inspectors go and inspect these facilities for good manufacturing practices to comply to the international standards. So when these products at a time of being brought in, they verify that information still. So that product is allowed on the market to be sold. And when it is sold, it is responsible what we call the local technical representative. So before a foreign product is allowed on our market, there is a local technical representative who is resident in Uganda to be responsible. Yes, to be responsible for those products, and in most cases this is a pharmacist, because these are people who studied medicine production and manufacturing and all that. So when the drugs come into this country, they are taken to what we call drug outlets. At the first point of center is the pharmacy. So when the drug is at the pharmacy, then it can now trickle down to the drug shop. But as we go further into this discussion, I'm going to tell you further about what is supposed to be found in the pharmacy and what is supposed to be found in the drug shop. And what's the difference between a pharmacy and drug shop? Because I think that is just in 30 seconds. The difference between a pharmacy and a drug shop is the range of drugs that are supposed to be handled at those levels. Because a pharmacy handles from what we call class A to class C. Class A and B are basically prescription-only medicines, whereby you're supposed to get those medicines when you have a prescription from a qualified person. That is a qualified person and certified by the Uganda Veterinary Board. That is the surgeon. That is as per the current laws. However, when there was scarcity, I can say that the vets, there's a study which was carried out by the World Bank and found out that in the veterinary drug distribution chain, it is only 25% who was vet surgeons. So because our mandate,
professionals,
yes, but our mandate also gives us about accessibility. So if we have 25% of the vet service in the medicines provided by vet surgeons, then the Uganda Veterinary Board certified another cadre, which is called a para-veterinarians from particular institutions, whom we have also allowed to operate the drug shops, or also who offer support to the pharmacies.
Oh, okay, thank you for that clarity. And Dr. Anna, let me just get to pose to you this question about the strategic systems that are being used. Just quite recently, I think probably you were involved on the 26th April this very year in Buyende district. There was I think a celebration done by the Food and Agriculture Organization, and the person who was representing FAO made a great recommendation and said that government and the partners were prioritizing animal and human health by empowering staff and implementing one health interventions, and then they advocated for a structured operational strategy in the management of animal diseases. So as a representative from the ministry, just of course with this extra support from partners, just help us to understand the system, the strategic systems and methods you're using in order to contain this. Of course you gave an introduction showing that you're very conversant and involved in having this dealt with.
Yes, thank you very much. The very example you have given is the one for One Health. We are now looking at One Health as a system of delivery, because we've looked at that a lot of time we are looking at human diseases by the time the human being is sick. But you find that most of those diseases, 75% of the diseases that affect man now, are actually coming from animals. And they are coming from the very animals that we keep, our friends, the dogs. They are coming from the cattle. They are also coming from the wild animals, the wildlife. So you talk about Ebola, you think about a monkey or something else. You talk about brucellosis, you're talking about a cow. You talk about rabies, you think about our friend the dog, and so on. So when we realize that some diseases are like that, then there are also diseases that are environment related. Like you talk about anthrax. The organism that survives to make sure that anthrax it keeps on happening on this earth is actually lives in the soil, and that is the spore. So you find that if you want to look after or make sure that you control diseases, you really need to look at the environment, its relationship with the cattle, the cow, or the animal, its relationship with the wildlife, and its relationship with the human being. So that triad, the animal, the human being, and the environment must be looked at. And therefore, we have now realized that we must go ahead, and this is at international level as well as in Uganda, that we must work as one. So that when you're talking about anthrax, you have to look around and see what is it that is out there that is encouraging anthrax. Are we invading the swamp? Because the spores will roll down with the water and they will be concentrated in the swamp. So what are we doing in the swamp? Are we invading the swamp? Is the animal going to eat from there? And that's why it gets anthrax? And this animal is going to die of anthrax? And then the human being will say, no, this animal doesn't look bad. I think it just collapsed. And the animal, people will eat this animal and then they will die of anthrax. So the strategy of One Health is now the core strategy. Of course, at individual levels, as the Ministry of Health must look at these diseases when the human now gets sick. And then, of course, there are also other diseases that are not originating from the animal per se. And then also at the Ministry of Agriculture, we also have those diseases that not necessarily zoonosis. Zoonosis is a disease that affects both animals and man. That we're talking about anthrax, we're talking about anthrax, rabies. Those are the diseases that we call zoonosis. Away from those zoonosis, we also have core issues like foot and mouth disease. It doesn't affect human beings as a disease of the humans, but it will affect the community by the fact that it will reduce the milk yield of this animal, and that is the food for the human being, and also that's the milk that you sell to get money for tuition for you. So it's a whole intricate system. Whether it doesn't affect human beings directly or it affects only animals, it's an intricate system. The whole well-being of a human being depends on all this environment and the animals. So we have to work
and the
together.
Human beings. And,
And
of
the
course,
human
I'll
being.
talk to you. You need to give more elaboration on how you're dealing with managing man who goes to encroach on the habitation of the animal. Dr. Sylvia, when I come back from the break, you talk about how the profession is dealing now with the farmers themselves. What is the effort in there to make sure that there is prevention, there is intervention, but with the farmers, the people who are really the stakeholders on the ground? And our viewers, please let me go for a break, then we come back and delve much more into this very interesting but technical area of concern in agriculture.
NTV, turning on your world.
And thanks for keeping with us. I'm Karagaba, Baldwins, and it's a beautiful Saturday evening. And we are talking about animal diseases and the proliferation that comes from the lack of control of those particular animals that we either domesticate or that are in the wild. And on our social media platforms, again, we've posted another question asking you that what measures do you recommend for the government and general public to take in order to prevent any epidemic crisis of animal diseases breaking out in our population? And Gerard Kanya says, incorporate the One's Health concept using a multi-sectoral approach by strengthening environmental health and public health. And then you have Emil Dixas. He says that it is very unfortunate. Some of the diseases they talk about never exist. They put quarantine to sell their own. And lastly, Percy Namatov says that identify those diseases in animals and vaccinate people because it could be difficult to avoid interaction with animals. Thank you for your contributions. Please continue having them coming in. So, Dr. Sylvia, the president of the Uganda Veterinary Association, and of course, I've already alluded that you're governed by the Uganda Veterinary Board Act, which is having current activity stipulations stating that you need to register professionals, maintain the National Veterinary Register, monitor and enforce standards in the veterinary training institutions, practice and professional conduct, all that. So on your part, just help to let people know how, especially the farmers, how you associate with them, how you help them, how you intervene in giving preemptive, perhaps, caution and intervention in these issues of diseases that come from animals.
Okay, thank you so much. Uganda Veterinary Association, as I said, is a professional body, but it's in a unique position. Veterinary services were privatized at the beginning, early 90s. And I think it's one of the few professions that were privatized, and for almost 20 years there was no recruitment of veterinarians coming out of the university. And the Uganda Veterinary Association was entrusted.
Recruitment where? What do you mean?
Into public service. So the Uganda Veterinary Association has...
First get all of us, all the doctors here, all of you are veterinary doctors?
Yes.
Ah, okay.
For some good years, there was no recruitment of veterinarians because veterinary services had been privatized. I am sure everybody understands what privatization is. So Uganda Veterinary Association also works with the government closely. It has been a liaison platform. We support the government, we support the ministry in many aspects. Because when veterinary services were privatized, the Uganda Veterinary Association was entrusted by the government to manage the privatization loan fund, which is called the Veterinary Association Loan Scheme. And we manage that scheme with the Centenary Bank. So we receive the applications. We are the ones who recommend people to Centenary Bank. We're in touch with farmers. We're in touch with the government. So as we look at UVA, it's not just like any other professional body. We're in a unique position given the mandate and the role, the roles that we are playing to support and complement the ministry and the government. Recently, veterinarians have been recruited, but the numbers recruited to public service are still quite few. So as the Uganda Veterinary Association, we strengthen the private side. We are in this dispensation of public-private partnerships. Yeah. And I think we have done a good job. Our members, whether they are with the government or they are on their own as private veterinary practitioners, they do support our ministry. In case they detect a certain disease in their area where they're operating, they help forward that information into the public system. Because we no longer have vet scouts in most of the districts. They were phased out when retrenchment came. We had a structure.
Vet scout is what? We
had a structure of the lowest cadre of veterinary practitioners in the government system, public system, who were called veterinary scouts, veterinary assistants. They were at the lowest level. They were close to the farmer at the grassroots level. They would help to detect a disease when it's just starting on the farm. As I said, early detection, early reporting, timely response are very key. And they were really at the core of the surveillance system. There's something we call surveillance, which I hope the Commissioner will elaborate more. Disease surveillance for us in veterinary services is very important. It is through surveillance that we can detect that there is a disease on farm X before it gets to farm Y. When we have weak surveillance system, it means that the disease will move from farm X to Y and Z before it gets, actually we get to know and to intervene. The sooner we intervene, the better. When you intervene when there's only one animal on the farm that is still affected, you isolate that animal, you deal with it. It will be cheaper to deal with that disease when it is still in one animal than when the whole farm is affected or the whole village is affected. So that lower cadre of veterinarians helped us to strengthen the surveillance and reporting. We lost that at the era when the retrenchment came in and privatization came in. So right now, it is the private veterinarians who are practicing in these communities that have helped in a way. Because there are some of our districts where you find there is one veterinarian who is the DVO, District Veterinary Officer, who is doing the administration work. He's doing the coordination work. He comes to Entebbe for meetings at Kampala, and he's the only one in the district. So there are some districts where you still find it's mainly the private practitioners. But for as long as they are members of the Uganda Veterinary Association, they are handy, they do support the farmers, they do support the government vets, including our Madam Commissioner here. Some of the information she gets actually trickles in through the private veterinary practitioners. So
the association is an establishment by government, it's just a voluntary
membership? It is a
membership?
Professional body,
yes.
But the government, there are some roles that have, we've been entrusted with certain roles to support, and knowing that we don't have veterinarians in every parish, in every village. So any veterinarian, wherever they are, they know that we have a responsibility to report. So we come in handy. We advise the farmers. Uganda Veterinary Association is also represented on the One Health platform, the National One Health platform. We are represented. So we still collaborate with the environmental health people, with the Ministry of Health, and with our partners. We have USAID supporting us through Global Health Security Agenda, FAO, and other partners. So as UVA, we work with everybody. We work with the government partners, and we work with the farmers closely. Veterinarians, we are friends of farmers. We are friends of animals, we are friends of farmers. And what affects farmers concerns us, because we know that the real survival of our profession depends on the farmers doing well. When the farmers' business is prospering, that's when we are fully employed. So we do value our partnerships with farmers, and veterinarians do collaborate with a number of farmers associations. We would like to do more. Sometimes farmers don't appreciate us because of the constraints that I pointed out early. When a farmer calls you and you take 5 hours to arrive, he gets annoyed with you, he thinks you don't care. But we are actually constrained in most of the districts I've visited. If a veterinarian doesn't have reliable means of transport to move from his office to where the farmer is, it will take much longer. So
you need support from the ministry, and I guess
we need more. I appreciate the ministry and the government. They have given some transport to our members, but there is still a gap. We still need more if we are to reach the farmers. The other thing that district veterinary officers used to have drug stores. The government, the ministry would procure veterinary drugs and store them. So when a farmer calls, a veterinarian will simply pick that drug and run to treat. Now that is not the case. We don't have stores with the drugs at the districts. So this vet has to go out actually and buy or get a drug on credit from a drug shop, from a supplier. So all that delays causes in the delay in terms of our service. But otherwise, we wish the farmers well, we support them, and we go an extra mile to actually serve the farmers.
Sure. Okay, thank you about that, and I pray that it becomes more successful. So Dr. Jeanne, that is a supply chain issue, of course, plus the governance. And there are efforts, definitely, and I agree, because there is the Ministry of Health report that shows that you're implementing the National Supervision Performance Assessment and Recognition Strategy, which is called SPAS. And it's supposed to make sure that it helps in the improvement of management in all districts to ensure that there's medicine management supervisors having to receive intensive training, motorbikes, computers, and that is, I think, an answer to her. But the aspect of the supply chain system, how authentic are these drugs? When you're making importation, how do you ascertain or verify that these people are quite reliable, they are competent? And you said there's someone who comes in here, but who now superintends over that person who comes to represent the supplier on the other side? And how is the distribution and the supply chain system clean? Isn't there adulteration, counterfeiting of these drugs?
Thank you, moderator. You're right, but I think when you talk about the SPAS, it is more to the human than the animal. I think the president has identified some of the challenges that the vet sector
So this SPAS is not integrated into the veterinary
ground. It is not in the veterinary ground. However, in the veterinary ground, as I told you, have 2 outlets. That is the pharmacy and the drug shop. Then we also have an importer. Now, I told you about the local technical representative, who should be a resident in Uganda, and this person should be qualified with a qualification.
What about the importer? Okay, talk about also the importer. Because that is where also the trick might be.
Yes, even the importer, definitely there's what we call the articles of association. It has to be an entity which can be sued and sue. So it is a legal entity, definitely. The importer has to have a legal entity which looks at all those qualifications and all those things. And remember, I've told you...
Are they certified by NDA? Are they...
I told you that for vet, most of our drugs are imported in. Apart from now, we are just developing and we have 3 manufacturing facilities. And definitely they are qualified because we have what we call guidelines on how to allow in these people to bring in their products into the country. So on the local scene, there's what we call the professional bodies. The professional bodies provide certificates to the practitioners. That is the professional bodies. We have the Pharmaceutical Society of Uganda, then we have the Uganda Veterinary Board. So these are the certificates that we look at when you want to deal with NDA business or the drug business. That is on the professional side. Then the academic side, definitely it has to be a person who is qualified from a reputable institution, also recommended by the Uganda Veterinary Board.
Before you get into the business of veterinary drugs, you have to be qualified academically in that line.
Yes.
Okay.
So all those are qualifications. Then you say that the lower level, you said, how do you scrutinize these people?
Yes.
So even we go as far as the local governments, up to the chairman 3s, before even a person applies to operate a drug shop or a pharmacy, has to go through the chairman 3. The chairman 3 endorses and says, yes, this particular person is known in the area and we are sure maybe studied these, but it can only be confirmed at another level by the district veterinary officer. So also the district veterinary officer endorses on the applications, which are picked by what we call our district drug assistant inspectors of drugs, resident in the district. So actually ND has decentralized these services. Then from that level, from that district, then it goes to the regional level. ND will have 7 regions distributed across the whole country. We have our regional office in Tororo, another one in Barara, Hoima, Arua, Lira, and and then Nakawa, which oversees the central region. So when these applications get to our region offices, they are again now scrutinized to see whether all those processes were taken care of. So from there now we give our license to operate a drug shop. And even before you operate a drug shop or a pharmacy, our inspectors go and inspect for suitability of premises. So our NDA premises have 2 certificates, the one to operate a drug shop and the suitability of premises. Suitability of premises means that the drug will be stored under ambient temperatures or conditions as was stipulated by the manufacturer. That is, for example, have drugs which are supposed to be kept under the refrigerator. Those are mostly the vaccines, which should be kept under cold chain. And then we also have drugs in Uganda. Scientifically, we are in zone 4B, whereby our temperatures are 30 plus 2. So our drugs have to be in that range. And so we also have our inspectors who regularly go and inspect the premises for compliance. And in those premises, definitely we require that a person hangs our certificates, and which can be seen by the consumers of those products in those premises. However, in most cases, you find that those drug shops or premises do not display our licenses, and we always continuously sensitize them to always display our licenses, because that is the only sure way you can know that you're getting drugs from a qualified or a licensed premise, which is always monitored by NDA. So when our inspectors always go for surveillance and inspection for compliance.
So the person who is seeking to buy drugs needs to look out for those particular certifications.
Although we also have a challenge that in most cases NDA gives, like I've told you, the process and procedure. We give our license to qualified person and a person who is also well registered by these professional bodies. However, we have one challenge, that the professionals, in most cases, they leave their unqualified personnel in these outlets. So I think going forward, like you gave, one of the roles of UVB is to register the personnel and also to register practice premises. I think going forward, NDA and our collaborative partners are thinking of improving that distribution chain, because if in the beginning I told you that a pharmacy is supposed to hold all classes of drugs from A to C, that is A to B prescription, for example the antibiotics.
Yes.
But when you go, you find them in most of our outlets in the vet, and maybe we are thinking that this could be contributing to the antimicrobial resistance. So going forward, actually, we are working together with a professional body and our other collaborative partners, like our commissioner, and we want to now revamp the drug distribution channel, whereby we are saying maybe if you want a drug, you have to present a prescription to the pharmacy, to the qualified personnel, which has been written by the vet surgeon or a practitioner from Dr. Sylvia's arena.
But that's if those people are there. If for me, I want my animals to survive. Okay, so on that
so it's
note,
another discussion.
Yes,
it's another lengthy discussion that
absolutely.
we need to think about. It's still in proposal.
Yeah, and now let's just talk about Dr. Rose, about the contribution of the human beings themselves encroaching on the habitat environments of animals and attracting these diseases, and perhaps consequently we suffer because we've done something wrong. Is there an evidence of where these diseases have gotten to contract people because people have gone into environments that are naturally habitats for these animals? And how are you dealing with that?
Yeah, the easiest now to give us an example is actually Ebola. We have gone into the environment of primates, and those are the wild animals that resemble us.
Yes,
or
monkeys,
baboons, and so on. We've gone into their environment by cutting down the forests, and then the monkeys are coming to look for what to eat from our gardens, and therefore they are touching the maize that we have planted. And yet, if we had not cut down their forests, they would be having the fruits to eat from there. So this is one of the most important way we have interfered with the environment. But we have also interfered with the environment by making now these animals our food animals. So
eating monkeys.
Yes, eating monkeys and baboons and all that. So in this interaction, as you cut the animal, as you remove the skin, you are touching the skin and the tissues or the blood of this animal, and it has the viruses. So that's the easiest way that we have interfered with the environment. We have also interfered directly. We are not supposed to eat dead animals. But you find that an animal dies in the night or even during the day, and people say, no, this animal is it looks very good, we must eat it. And then we are interfering with this animal. We are supposed to eat healthy animals. And all the time people say this, when you introduce yourself as a vet, people will say you are a person a doctor who eats your animals or your patients. No, we don't eat our patients. We eat healthy animals when they are healthy. But when you start eating patients, that's the interference.
Yes.
That's the example. I would also like to talk about what the social media has asked about. Vaccinate animals. Yes.
Actually, we're coming to that, I think, in the wrap-up point.
Yes.
Yes. So the government, literally, the implication here is that the government arms, which are supposed to protect the environment, need to be more emphatic. They need to be more assertive, and they need to do their job so that forests are not cut down.
But we also have to realize that the government people who are supposed to protect forests, there are not so many. They cannot stand around the forest, for instance. I always talk about the wildlife and interaction with the diseases. That because wildlife diseases also come into the animal population. But the people in wildlife cannot stand around and make sure that they are policing animals. That's why they are called wild. The word wild means that they are wild and they should be out there. So it is us to protect ourselves against them. So it is very important that people know that the interaction should be as much as possible reduced.
Okay.
And we are all responsible for this. We don't have to say that's the work of Forest Authority, That's the work of Uganda Wildlife Authority. It is us who are also responsible. The whole population should accept and know that we should not interfere with the environment. For instance, the swamps. We are not supposed to go and dig in the swamps. You destroy what would have caused held water. We should go back into the atmosphere, and we have rain. Now we are having drier and drier weathers. We are having climate change because of these interferences. The forests are supposed to hold water, which will finally evaporate into the environment, and we have rain. Now we are having more and more poor rain seasons, and this will come round into poor productivity, and therefore poor health in human beings. So all of us are responsible. There are those authorities which have been given, but all of us are.
Just on that, because I need to go for a break, otherwise be cut off. Yeah, fully understood. It's a general problem for all of us. And Dr. Sylvia, I'm going to talk about just the issue of vaccination. I know you wanted to add on something on that matter, but let's go for a break, come talk about vaccination. Thanks, our viewers. Please, let's go for a break and wrap up this discussion shortly after. Thanks our viewers for keeping with us. Let's wrap up this discussion. Quite intriguing and of course concertingly demanding of the entire population to make sure that we are responsible in how we deal with our animals. So Dr. Sylvia, the role of vaccination in this particular endeavor, do you vaccinate the animal exclusively? Do you have to vaccinate the animal and the human beings, or just the animal is sufficient?
Thank you so much. Vaccination is very important. Vaccines are an important tool in our profession. In as far as animal diseases are concerned, we have about 3 levels of dealing with them. One, first of all, is biosecurity, preventing, making sure that the disease even does not get onto your farm. That is the first line that every farmer must engage in on a daily basis. And when you do that and put some measures in place, it means that the disease incidence and prevalence on the farm will be low. The cases or the frequency of getting diseases will be much lower on your farm. Apart from biosecurity, we also vaccinate. Now, when you observe biosecurity, you don't allow everybody to walk into your farm. You don't allow every visitor to walk into your poultry farm. You don't show every relative and friend who visits you, oh, come and see how I'm raising. That is very dangerous, but sometimes our farmers do that. So we discourage them from doing that. And when they have done that, they have vaccinated, we expect that the frequency of diseases on any farm should be much lower. But should a disease arise, when you have observed biosecurity and vaccinated, we expect that maybe out of 1,000 birds, only 5 will be affected, 5% will come down with a disease. The others should be protected given the measures that we put in place. And when that happens, of course, then we say isolate them and treat. Of course, many times in poultry we treat the flock. You treat the whole house. Yes. When you find one sick bird, even when you isolate, you still treat others, given the way they feed and the way they share the water sources. So we look at the flock rather than the individual. It's not in humans where you treat an individual. We treat herds, we treat flocks, especially for poultry. So vaccination is very important. Unfortunately, I've met farmers who say when veterinarians mobilize them to vaccinate, they say maybe they want to pay school fees, maybe their children are at home. That's why they are inviting us for. Make money. So we need to trust each other. Farmers need to trust veterinarians, and the veterinarians, we need to be trustworthy. So that when you tell the farmer, you go around mobilizing them and say we are doing mass vaccination, let them know it's for their good. And some of our farmers want to first see a sick animal in their herd before they vaccinate. When you tell them the neighboring district has the disease, let us start vaccinating. They say, but it's not here, it's very far. But these diseases move, like foot and mouth disease. It's airborne. It can be blown, can be carried in our shoes, can be carried in our dresses, can be carried on the bicycles and the border borders that crisscross. It can be blown by the wind over a long distance. So let farmers trust us. When we say it's now vaccination, let us vaccinate. And as I end, this year, we are celebrating World Rabies Day on September 28th. The theme is rabies, vaccinate to eliminate. I call upon all our members, UVA members, all veterinarians, all Ugandans, and even the people on the health side. Let us work together. Let us encourage people who are keeping dogs, who are keeping cats, to actually support this vaccination campaign. We are starting the activities soon, and UVA will be spearheading and working with the ministry and all the other partners. And of course, our members, as I end, I make an appeal to Minister of Health. Veterinarians should be vaccinated against rabies because we are a profession. It's a professional hazard for us. Veterinary students should be vaccinated against rabies before they start touching the dogs during their surgery or medicine clinics. This has not been done. I've written, I've made a request, and I'm still waiting for a response.
And you have
I hope it can be done. I thank you so much.
Thank you, Dr. Sylvia. Just 2 minutes, Dr. Jeanne, because we're running out of time, and also Anna Rose. Also 2 minutes. The problem of cumulative drug deposits in the meat of animals, which are consumed now by human beings, and they develop, because research is out there, is showing that this has caused people to get cancers and very irreparable and irreversible fatal diseases. How should the public deal with this? Just 2 minutes, kindly. I know it's a wide issue.
Yes, it's a very wide issue, and which we cannot finish now.
Yeah.
But maybe what I have to tell public is that with National Drug Authority, with a mandate given to us, there are particular drugs which are banned internationally and not allowed to be used for animal producing, food producing animals, that is cattle, goats, and all that. An example is in 2015, National Drug Authority had to deregister or recall 3 products in a class called the nitrofurans, famously called the furozolidones. They were used in poultry. We had to recall them back because science had shown that those products are carcinogenic. So during our regulatory processes and evaluation, we don't register these products that we find that are of hazard to the consumers of the animal products. That is one level. Now, what Ugandans have to be concerned about is, for example, in the past we were rampling with the issue of formalin when they were saying that is meat. So Ministry of Agriculture, UNBS, carried out a study, and the government analytical lab, they carried out the study, and basically what they found was that the issue was not formalin, but they found heavy levels of pesticides in the meat, which is even more dangerous
than formalin.
So we call upon the people who supply meat to be ethical and not to spray these pesticides on the meats in the name of repelling the flies. Then what is very worrying...
that should be yeah, 30 seconds, please.
Okay, what is also very worrying is the aflatoxins. Aflatoxins basically are passed on to the meat, especially in poultry, because in homes you find that what is rejected, the grain that is rejected, for example, that has molds, is given to the animals, especially in poultry. So those aflatoxins accumulate in the tissue, in the animal tissue. So when you take these aflatoxins accumulatively, then you're also going to develop cancer. So everything springs at the good practices that are out there. However, also the public has to know that the Ministry of Agriculture, Animal Industry and Fisheries, together with collaborative partners, are also putting in place systems to monitor these residues in our foods, maybe to give a flag to the people that, hey, there's a problem.
Okay.
Now, on the behalf of National Drug Authority,
yes,
we call upon everyone that if you use a drug and you get a reaction, it's not working, you will report to us, and we shall come back to give you feedback.
Okay, thank you, Dr. Jeanne. Dr. Rose, actually now, just a minute for you to wrap up, especially about the future of this particular threat. Do you think in the next about 5 years we'll have less spread of this problem, or you think if we're not more careful, we're going to have it worse?
If we are not going to be more careful, of course we shall have it worse. But we are working together with you now, at least. We are working together with the public, and we call upon the public that it is very dangerous. It's for our own detriment. And it is worse still for you, the farmer, who is actually giving these drugs to the animals. Your children are the ones who will eat most of the eggs. Your children will drink most of the milk, and it will go out there. And therefore, we call upon the farmers that let's work together let us listen to the veterinarians. Let's not hear things like they want a quarantine just for the sake of them selling their animals. We are not here to sell our animals. We are here to serve the public. We are serving you, and therefore we really get disappointed that people are thinking that quarantine is to stop the animals that are sick from joining or moving, getting into contact with others, so that the disease doesn't spread. That's the reason why we do that. And the reason why quarantines are going on and on, it's because we talk about it during the day. At night, people are moving the animals. So you find that as a commissioner, you want to open the quarantine and let people trade, then there's a disease outbreak in another corner, just because somebody stealthily took animals from one end to the other. So I am really calling upon the public that trust us, like our Veterinary Association president said, trust us, we are here to serve you. That's what we swore to do, and we swear it as we graduate. It's not just a matter of talking about a formality. We swear it with the Bible as we graduate. So we are here to serve the population, and please trust that when we put a quarantine, it's really for serving the population.
Wow, and for sure, for such an intricate and subtle topic, to make sure that you make it relatable to the public, is such a noble job that you have done pretty well, in as much as we are constrained by time. And cattle theft, that's a different topic, really. So Dr. Anna Rose Ademun, OKurut, the Commissioner Animal Health, Minister of Agriculture, Industry, Agriculture and Fisheries, and Dr. Sylvia Baluka, Agubua, President of Uganda Veterinary Association, both board members of the National Drug Authority, and Dr. Muhindo, Jeanne, Bukeka, the Head Veterinary Products National Drug Authority. Thank you for being profoundly very informative on this particular subject, which seems not to be hugely relatable to the human, but very vital indeed for all of us to understand. Thank you, and God bless you. And our viewers, we are grateful for keeping with us this evening, and for keeping us as your #1 station. And please let me have you enjoy this music this evening. God bless. Keep logged on to NTV.
This is NTV.